More than 795,000 people in the United States suffer a stroke each year. If you or someone you know have experienced one, you understand the significant physical deficits one can cause. My name is Rihanna LaFleche, and today I will be talking to you about the positive impact mirror therapy has on regaining motor function in patients that have experienced paralysis of a limb after suffering a stroke. When someone has a stroke, they typically experience some type of paralysis. This is when movement is lost in some part of the body. Paralysis can occur in different patterns. The one I focus on is hemiparesis, which affects one half of the body. You can see this in the first photo in the second body. Now you might be wondering what exactly is mirror therapy. It's a rehabilitation technique using a mirror for visual feedback of the moving limb. A patient will place the affected limb behind the mirror while watching the reflection of the unaffected limb perform the movements. In the review of literature I completed, I looked at research using mirror therapy on both upper and lower extremities. I found mirror therapy in conjunction with conventional therapy like occupational therapy and physical therapies to be the most effective. In these studies, participants were asked to perform exercises like flexion, extension, different tasks of activities of daily living like squeezing a sponge or reaching for an object. And then you can see in this bar graph, this represents the voluntary control grades or VCG scores indicated by the blue bars. Blue bars represent an improvement in motor function and voluntary control of lower extremities. More outcomes show positive impacts on motor recovery, ambulation, and balance. Mirror therapy is easily accessible, very cost-effective, and not only great for patients that have suffered a stroke, but also beneficial in reducing pain in those that suffer from chronic regional pain syndrome type 1 and phantom limb pain. There is no negative impact shown using mirror therapy, but more research could be done to prove further positive outcomes in regards to sensory impairments and using neuroimaging to track the progress of these treatments. Ultimately, I believe mirror therapy should be implemented in the rehabilitation process of stroke patients in conjunction with conventional therapies in order for the most efficient recovery. Thank you.